We begin tonight at 6 o'clock with big changes for Hoosiers who receive Medicaid benefits and use a plan called MDwise to manage those benefits.
So come the first of the new year, the state is going to drop its contract with that company, MDwise. So 13 News State House reporter Emily Longnecker explains what it could mean for the 300,000 Hoosiers who right now are on that plan.
If you use MDwise to manage your Medicaid benefits in Indiana, by January 1st, you'll have to choose another company for the job. The three choices you have: Anthem, CareSource, or Managed Health Services.
If anyone that is on MDwise right now, they're going to receive a letter from us, but even if they decide to do nothing at all, they're going to be auto-enrolled into a plan that's nearly identical to their own.
The Family and Social Services Administration, the state agency that runs Medicaid, announced the change this week, saying it was time to part ways with MDwise.
So we looked at their quality ratings, and they were consistently the lowest quality managed care entity. And we also looked at costs, and they came in consistently higher costs.
FSSA could not say how much the state expected to save ending its contract with the company. The decision to cut the plan comes as the Braun administration has sought ways to curb the growing cost of Medicaid programs to the state. MDwise says they've provided services to Indiana for over 30 years and pushed back on FSSA's allegations about the quality of their care and its cost.
In all of our asks to FSSA, we have yet to see anything that substantiates low quality, high cost. They haven't given us any data, provided us any expanded information.
MDwise says a January 1st cutoff doesn't give plan members enough time, especially if their doctors are not part of one of the other remaining plans.
As our members move, they might have to choose another provider, or in order for the next MCE to get that provider into their network, they're going to have to go through a credentialing process. And that process it does take time for those changes and switches to occur.
FSSA said they don't expect that to be a problem for providers who might consider joining other plans.
I'm sure right now they're evaluating based off of the information that we're announcing now, whether or not they want to be members of other plans.
MDwise has asked the courts to step in and review their contract with the state.
Thank you, Emily. They've also asked the federal government to look at FSSA's decision to give their members and employees more time for this transition to happen.